My name is Doriane Sabushimike. I'm a consultant dermatologist at the Regional Dermatology Training Centre in Moshi in Tanzania, but I am from Burundi. I've been in the RDTC for the past 6 years. I came here in end of 2017. That's when I started my training in dermatology. I graduated 2 years ago, and since then I've been working at the RDTC as one of the consultant dermatologists and also in some of the community projects run by the institution. So I did my undergrad training in Rwanda. Yeah, that's where I did my 6 years of, because there they do a program of 6 years plus 1 year of internship. I did them in Rwanda, and then I worked there 2.5 years before I joined residency in Tanzania. When I was young, at the age of 2-3 years old, I suffered from severe chronic eczema. And I remember my mom used to walk with me and my sister looking for a dermatologist. And at that time, apparently we had only one dermatologist for the whole country. And it was really difficult to get an appointment to be seen by him. So I grew up then frustrated by my skin condition, first of all, without knowing how it's supposed to be treated, because it's a chronic condition, and the way we treat it is more of controlling it. But nobody was telling my mom how to do it, until they were even telling her, oh, we think that your kids are allergic to Africa. You should take them back to Africa. But just that at that time, she didn't get the specialized doctor to treat us. And imagine, since then, apparently I started telling my parents that I would be a doctor, that I would be a skin doctor. But then, funny enough, when I did my rotation in the different departments in medicine, when I was in dermatology, I said that this is where I want to be. So my area of interest in dermatology is community dermatology. Training in a center like the RDTC, it's a high privilege for me, because that's where I got to be exposed to see how community projects help more than sitting in a clinic and see patients either who can afford to come, like transport, because some of them, they are traveling for 3 days to come here. Also because they have insurance or they are able to pay for a consultation. But when we do community community outreach, we go and find the patient in their community and screen them for some disease, depending on which community project that we are doing in that day. So when I was exposed in that kind of environment here at the RDTC, when I was in my residency, I realized how you can be a change maker by going in the community. You have the accurate situation, first of all, like what is really happening there, why are these having this kind of condition and why they're not able to come to the hospital. I think it's the best way to tackle some neglected tropical diseases, or not even neglected, any skin condition, especially for people who are not able to come and be seen in the clinic. So yeah, that's what motivated me, because I was like, why being a doctor for those who can afford to come and see you, when you can be the one who find them where they are and screen them, treat them for the conditions that they have. So that's what inspired me, like being part of this community project in the RDTC. Actually, this is my 2 last weeks here in Moshi in RDTC, and because I'm going back to Burundi, where I am setting up a program for care for people living with albinism. We actually had our first outreach clinic a month ago, where I went with a team from the RDTC, because they are my collaborators and also support system since day one, when I decided to go and implement some of the projects that they are running here. So we are going to, in Burundi, my dream is to run some of the community projects that I have in RDTC, and also have a department of dermatology in the hospital that is going to host the project. And maybe in the future, something like RDTC, like a training center in Burundi. The implication of ILDS in the project that we are setting up in Burundi is also big, because the first grant that I received to implement the project is from the ILDS, the DermLink project. And for me to get the information was through people who are from the ILDS, and that is Dr. Claire Fuller, because she's the one whom I talked about the project the first time, and she is the one who told me about the DermLink, and that could be I can get funded to start, because they give grant for people who are starting a community project. So So ILDS was they played a big role, because with the project, with the grant that I received from ILDS, I was able to buy some materials and also to run the first outreach clinic that we did in Burundi. And then now coming to GLODERM, GLODERM is the organization that introduced me to all the change makers that I know currently, actually. That's where I have my mentors, Dr. Toby Mora, Dr. Esther Freeman, and Professor Glover. I've been working very closely with these three women, and they are like more than mentors for me. They are my role models and inspiration. So yeah, and through them, I was able to be connected to other change makers from around the world, those who are doing the same project as mine, or those who are interested in funding and supporting my projects.